Party people! Zach Couples from ZachCouples.com. We're live at the Hamptons with my good friend, my brother, Cody Benz.
What's going on, intrawebs?
He is an amazing trainer in New York City, works at Drive 495. Looking to go to PT school. We're going to treat this bad boy and see what happens. But let's look at the star-studded cast here. Again, why not? We got Greg Spatz out of Brazilian.
Yes.
Physical therapy performance.
Yes.
New York City.
New York City.
He's got a phenomenal tank top. Phenomenal tank top. Get it. Get it. This is like the third time we've tried this, so this is why this is funny. We got Lance Goyke from iFast.
Intrawebs.
Check him out on iFastU. He is the man behind that.
Please, and so is this guy.
He's a good human being. We got my beautiful brother, Douglas Kachijan. Also from Resilient.
The internet needs to go away.
The internet does need to go away, but Douglas is here to stay. We got a new friend. Jason.
What's up,
Jason
everybody, guys? Brandeis University, Boston Cannons. Go Judges.
Phenomenal. Phenomenal ATC.
Go Judges, yeah. It's
The
the
Judges?
bad mascot.
Seriously.
I
It's
like
real
it.
bad.
Hey, Judge Dredd was pretty cool. Especially when it's Stallone.
Stallone version?
Yes.
You gotta see our
The
logo.
judge, jury, and
Real bad.
executioner. Double whammy.
You just quoted Judge Dredd?
Yes.
What's up, my people?
Look at this. This is the father-son connection, Bill Hartman. You can see the resemblance,
Yes.
right?
Clearly.
In the sense that we are both skinny SOBs.
Lots of
hair.
Lots of hair in
Yes.
this picture.
Yes. So he's here too.
Hola.
Alrighty. So, like I said, we are going to treat Mr. Benz. Cody, tell us what's going on.
So I was training on Thursday and was doing some dumbbell press.
You work out?
Occasionally. I did a couple push-ups once and it wasn't for me.
I don't like the sit-ups. It makes my abs hurt.
So I was doing some dumbbell pressing with some coworkers of mine and decided to take some rather heavy dumbbells for a spin and tweak my neck. So it's it had been feeling so-so, but sleeping on a air mattress last night and staying up late 2 nights in a row and woke up like today with the most pain I've had since. So
I'm sorry that you're going through that, Cody. That's no
I think I'm in
fun.
good hands.
We'll find out, right? At least we hope.
Zion chills in the neck.
So what particular movements, activities are bothering you as of right now?
Like flexion and then just like flexion rotation. So like if I try to bring like my chin over my collarbone, it hurts both sides. Rotating more so to the right hurts more than it does the left. So
might have to make you more comfortable to start. Okay.
yeah.
Anything seem to help, or any movements that you've tried?
Not really. I've just been trying to move it as much as possible, like in
Gotcha.
the pain-free range.
No fear avoidance. That's good. We don't need to have the ion channels talk.
Yeah. So we'll have that later.
Please do.
Douglas is going to debrief me on the ion channels.
Yes. I always tag people in for other treatments.
Yeah.
Any other
Man, you're so smudged.
any other aches, pains, boo boos I need to know about?
No.
Medical history.
No. Pretty good.
Are you pissing yourself or crapping yourself?
High blood pressure, but that's
Blood pressure.
unrelated.
Let's just live
Um,
in New York.
Yeah.
Yes. High blood pressure from living in New York, and we don't call this anger issues. We call this anger solutions.
Yeah.
Right. Okay. All right. Well, so what we're going to do then is take a look, see how you're moving, see how you're grooving. We're going to see if you have any limitations. And I think have I messed with you before?
Yeah.
I mean, we all mess with each other at some
Yeah.
point, which
Well,
doesn't sound good.
We'll
but
touch each other. from
yes,
time to time.
yes. And then we're going to see what happens and go from there. So I will man the camera in this fashion. Why don't you go ahead and stand up, Cody, and let's just check standing movements, and we'll just standardize things. Let's go feet together.
Yep.
And when we get a side view to start, go ahead and bring your chin to your chest. Talk to me.
It hurt, like about halfway down, I started getting pain. Like,
Okay.
It's more so on the.
And the
like,
pain is?
It's more so like in the right side of my neck. In the back.
Okay, so clearly limited, painful. Go ahead and look up as far as you can.
Is peanut gallery allowed to offer up like questions and stuff? Is this a Q&A?
Yeah, you can go ahead and do that. Okay.
What are you doing?
That's okay.
Just checking movement. I'm just checking all planes of movement. This is the reason why I'm doing this is like this doesn't necessarily. It tells me some information, but it gives the patient meaningful tests that they can go back to and say, oh yeah, that's better. Because if I, change some random mobility that I think is meaningful for my testing, it may not mean anything to him. So that's why that is the purpose, in my opinion, of a top tier examination.
Amen.
Let's see, turning your head to the left.
Courts in session.
How are we doing with that?
Not bad. A little bit of pain over here. Very little though,
Okay.
towards the end.
Okay, and then how about going right? Okay,
Right
so
there.
definitely,
Yeah, same
definitely
spot.
limited. Okay, back to the start. Let's have you tilt your head to the left. How are we doing with
That's
that?
okay.
Okay, how about going right?
Start to feel it. Yeah.
Okay.
Yep.
So most of the things are going ipsilateral and closing. Is that
Yeah.
fair to say?
Yeah.
Okay. And I don't know if we'll be able to see FA rotation or hip rotation. Yeah, that's not bad.
Not bad.
Alrighty.
Yeah.
Okay. So we're gonna check his hip range of motion to start because we look at everything. What do we got there, guys? It's not bad. 45-ish. That's actually not too bad either.
Yeah.
Call it 30.
Does that hurt?
No.
Check.
No.
A little tighter there.
Yep.
25-30. Really good there. 45-50. Any problems with that? You don't have any lower body issues, Cody, do you?
No.
Okay. Good. Let's have you lie on your back next. We'll talk. Maybe this is a discussion too we can have as we're going. I don't check the Thomas test anymore.
The who what?
The Thomas test.
Why?
It doesn't really add anything for me. I mean, you can appreciate hip extension in an Ober's.
Why do an overs?
Right, to check frontal plane mobility of deduction.
Doesn't matter how you check it.
You don't check it anymore?
No, I check it. It just doesn't matter how you check it.
Gotcha. Okay. 6 1 half dozen the other.
We don't matter. That was the theme all weekend.
All right.
Nothing matters.
Cynicism.
I was going to check lower trunk rotation on
Yeah,
Cody.
especially doesn't matter.
Any trouble with that?
No.
Why do you check that?
Intercostal respect. That's why I think it's like checking seated, because I think
I think that rationale is infinitely a better rationale than going after like something spinal.
yeah. That's why I think multi-segmental rotation is checking, because like if I can't check horizontal abduction,
And I think you got way too much stuff going on there.
there is, but comparing the two is helpful.
Complex movements are compared.
Any problems with that?
Nothing more.
We're good. 70. Yeah, let's see what we got here. Okay. I wanted to check this to see if you might have a little more left than right, but it's pretty close.
They feel equal, just like maybe a little less tension this one.
Yeah. So you may have a little bit more on that left side, which again, the way that I think of that, if you have more on your left side, then you're gonna have a harder ability offloading your right side. Is the way that I think of it as. So like I was randomly treating this chick at the gym that I train at in Page, Titanium Fitness by Infinity. They're good people. Come check them out. And she was having sciatic symptoms on the right side, but she was able to achieve a full toe touch on the left, but not the right. And it's like the problem was that she couldn't offload her right side because of the excessive mobility on her left hamstring. So we gave her that, and then she was
Sure it was a hamstring?
left straight leg raise, whatever it was. But it's like I gave her a left hamstring oriented activity, and then she was okay.
Yeah.
Yeah. So I'm not sure. I'm not sure what I did, but that seemed to help. There you go. Any problems with that, Cody?
No.
Okay. He's got full flexion on that side. Sorry, people, if you didn't see that. I probably should check camera-wise, but can't see this.
You just call it numbers.
Yeah. I mean, that's probably about 85, 90. I mean, he's definitely shy 90 on that side. Definitely limited on that side. We'll say 25, somewhere around there. And if we look at the left, any issues there?
No.
Full. Yeah, equally limited, 85, 80, somewhere around there. A little more IR on this side, but still kind of limited. Some multi-directional limitations there. I'll check horizontal abduction momentarily. Let's just get a feel for what you got neck-wise. Any problems with that? I'm going to rotate in.
What are you doing?
Just checking neck rotation. Oh, thank you. So I'm checking just the ability of his entire neck to rotate. So I'm approximating him at, in theory, C7T1. Gonna turn right. Any discomfort with that?
No.
Looking for about 45-ish degrees. Or just more comparison side to side. He's a little bit more limited to the left. Now we'll check mid-cervical, his ability to side bend. Any problems with that? And again, a little pain on that right side. Yeah. And then I'll give that a comparison to the right. He's a little bit more limited on the right side, even though he doesn't have as much pain going that way. Okay. So what we've seen so far is Cody has a lot of mobility in a straight leg raise. He's got limitations in rotation on both shoulders. And he's got limitations in neck rotation and a little bit in side bending. What I'm going to check next is scoot towards me. We're going to check horizontal abduction. This is transverse plane trunk rotation. Which is a little bit of, I kind of said the same thing twice, right? Scoot a little closer. And I'm looking for about 45. And he's a little thoit. We'll say about 15 degrees limited on that right side. Let's go ahead and go the other way. It's got a little more on this side, but still pretty limited. I would call that about 20. And then scoot to the middle. Last thing I'm going to check trunk-wise is just his ability to fill the opposite lung if I press down on one side. Go ahead and take a breath of air in, get it all out. Good, and just breathe normal. And I'm just feeling to see if you can get that to rise at all. Just breathe normal. Cody, get it out. Just breathe normal. That's actually not too bad. So he can, when I hold him down on this side, he is getting a little bit of fill on that left side. Now let's check the right, same thing. Breathe in through your nose. Get it all out. And just go ahead and breathe normal. So from a symmetry standpoint, I'd say you're a little bit more limited on the right side than you are the left. Last thing we'll check is just a frontal plane hip test. So go ahead and lie on your right side. Actually, go ahead and face the camera. Scoot back towards me. Bring your knees up to about right here. And so I'm going to block there. We're checking the right leg. Just let your leg relax. And I can't extend him whatsoever. We'll check hip abduction. And he's a little bit limited there as well. About 20 degrees. Go ahead and MC hammer to the other side. Or face the camera. Alright. Same thing. So he's I can't extend him to 0. That's what I'm trying to look for on this test. And there. Can't abduct. So go ahead and MC. So basically, people, what we're seeing, and Cody is very well versed in a lot of the stuff that I do, and that all of these fine people do here. Basically, we are seeing a reduction in mobility in many planes, and trying to compensate for that by getting a little bit of excessive mobility in the sagittal plane. So you can't rotate through here or do frontal plane motion in the thorax trunk and hips. So by being able to give you a little bit more motion, at least on the passive aspects in each of those areas, our hope would be that that allows you to get a little bit more freedom to move in your neck. So that's what we're going to try and do. And generally, when I'm at least what I'm thinking right now is like, yeah, he's having symptoms here, but what is the basic support that the neck goes from, right? And so we got this to deal with and this to deal with. And moreover, when I am in a stressed and threatened state and I am reducing movement variability and I'm altering breathing mechanics in such a manner as to compound that restriction of movement, which allows for a finer control, even though his neck is limited, the amount of accessory breathing that occurs in that region would potentially impact motion up here. Because if I have to do more work as a respiratory muscle, and if you read there's an article I linked on, or I will link at some point, that talks about 2 different recovery postures for heart rate in terms of breathing. There's a ton of stuff out there that they use in some of the studies showing that in patients with COPD, a lot of the accessory muscles are a lot more active as respiratory muscles as opposed to postural muscles. And so if I'm shifting the function of these muscles in one direction, I may lose their ability to perform as, say, if they become more respiratory driven, they may become less posturally oriented. So they lose their capabilities to move. And so if we can establish this as more, and this being Cody's diaphragm, as more of a respiratory driven muscle, that may take off the demands of some of the neck muscles as respiratory drivers and allow them to be more postural and a lot more free to move. Does that kind of make sense?
Yeah.
Now, if you were not a guy in the know, I would never go into that amount of detail. Basically, I would say, look, you have some limitations in motion here, and at your neck. Since in a lot of cases, we kind of all move as one cohesive unit. If we can just restore motion in a lot of areas with just something simple that you can do on your own, I think you're going to feel a lot more comfortable. So that's at least just how I would educate a patient. But since Cody's a bro and he likes to learn about this stuff, that's what I would say. So without further ado, what I'm thinking from a treatment standpoint for you is I want to see if you can do something on your own first to see how much that gets you. And then if you can't, then I'm going to kind of intervene with something manually. And so, given that, yes.
It's Cody's before picture.
So get, yes, and we'll compare the after picture. And so given that,
that Sons of Anarchy, it's Sons of Anarchy.
Given that Cody has a fairly big limitation in terms of rotational and frontal plane capabilities in the thorax, yet he does have a little bit of more mobility than I would like in the sagittal plane, the pelvis. We're going to see if we can kind of brainstorm an activity that allows him to maximize motion here while giving him a stable anchor down at the hips. So what I would need to be able to do is have this free, because if a great way to this meaning the posterior knee, yes. So my hand post the upper back, right? If I have someone who's a limitation in frontal and transverse plane, getting them a little bit more into the flexion-based position from a sagittal aspect is going to be immensely helpful, because if we think about the closed pack position of most joints in the human body, it's in a position of extension, which would limit the amount of degrees of freedom you would have in the frontal and transverse planes. So if we can get Cody a little bit more flexed into the thorax, that may free up a little bit more motion in the transverse and frontal planes of the trunk. But not only that, but since the cervical spine attaches to, or is on top of that, we may get some improvements there. And if we can provide a stable anchor at the hamstrings, then we're winning both things. So actually, I think I'm just going to keep you sitting.
Okay.
We'll see what happens.
Works for me.
Because we can get both that way. And you know what? Actually, here's what we'll do. Have a seat in the chair. But I want you push on the edge.
On the edge?
Yes, sir. All right, so we're kind of brainstorming this. This is some ghetto treatment.
Ghetto treatment in the Hamptons.
Can I borrow this stuff?
Right.
Ghetto treatment in the Hamptons, yes. So I'm going to put this right here. You're going to hold that. So I'm going to get him hamstrings and see if we can get upper back to expand. And so what I want you to do, yeah, you're going to slouch at your hips, and I want your weight on your butt bones. Got it?
Yep.
Okay. So intent with this, Cody, is I need you to feel this expanding, and I need you to feel hamstrings working. We're going to go one at a time, though. Okay. And the reason why I'm going one at a time, hamstring-wise, is just because I'll get greater muscle contraction that way. So what I'm going to do is I'm going to put my foot. There we go. Let me reorient this camera. All right. So I'm going to put my foot behind Cody's left foot because we're going to go left side first. Cody, I want you to dig your foot, your heel into mine, so he's pulling back. Do you feel this guy working?
Yep.
Awesome. Next, I want you to straighten your right leg. This guy should be sizzling. Good. Then what you're going to do is slouch at the hips. I want you to take your left arm, reach like that, and what I want, Cody, is a quiet inhale through your nose. I want you to imagine there's a big glass window here. Fog up the glass and reach with just your arm or your foot. And then pause. P-A-U-S-E. Quiet, effortless inhale. Fog up the glass and reach. Reach, 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 reach. Good. Keep this position. Don't breathe, don't breathe, don't breathe. Cody, I do not want to hear you inhale. Fog up the glass again and reach. Awesome job. Awesome job. Good. Hold. Keep digging. Keep digging. Want your foot flat though. Foot flat. Foot flat. One more. Quiet inhale. Fog up the glass and reach. Nice job. Take a rest. How was that?
Good.
Felt okay?
Yeah. Yeah.
Were you feeling any upper back expansion at
A
all?
little bit towards the end, yeah.
A little bit towards the end?
Yeah.
Okay. Okay. Cool. So I'm going to see if we can modify that to give him a little bit more. We're going to go on the other side. Same thing. Keep your foot flat. I thought your exhale was good and your inhale was nice and silent. I want you to slouch at your hips a little more. Is your weight on your butt bones?
Yep.
Okay. Get a little bit more right butt bone than left this time. Okay. That's going to give him a stable anchor in sitting. That's why we're doing that. Now, go ahead and dig. Do you got this guy?
Yep.
Okay. Right arm's going to reach this time. I want a quiet inhale. Fog up the glass. Reach. Rock back onto your butt bone. Good. Hold position. Hold position. Keep digging. Fog up the glass and reach. Good job. Don't breathe. Quiet, effortless inhale. Cody. Get it out and reach. Reach, 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 reach. Come on. Good. Quiet, effortless inhale. Fog up that glass window. Reach forward. An excellent cue that I stole from my pops, Bill Hartman. Phenomenal cue, seriously. It's been a game changer. One more.
Game changer.
Yeah. Fog up the glass, reach, rest. How we doing, boss?
Yeah, it's good.
Get upper back.
So yeah,
time?
feel him expand more.
Just looking at me right now as your neck because you're doing everything right.
Better. Yeah.
So we're heading in the right direction.
Still
Well
feel a little
done.
bit at the end, but I could get further.
Let's keep going. I mean, that's just with a little bit of volume, so we'll see how you do with a little bit more. Okay. Slouch. I want the foot to stay flat, and then just slide that way. There you go. I want your balance to be on the heel and butt foot on the other side. Does that make sense?
Mm-hmm.
So dig, kick the right arm straight or right leg straight. Same difference, right? Breathe in through your nose. Reach, 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 reach. Good. Quiet inhale. Fog up the glass and reach. Good. Quiet inhale. this. Reach. One more. Nice job. Awesome. Feedback on
Yeah,
this.
feels good.
We're doing okay?
Also, I
Awesome.
was able to keep the hammy better, keep my heel on the ground more. It was more grounded.
Gotcha. Now, Cody, I'm going to have you do it on the right side. And since you can't take me home with you unless you pay me a lot of money,
Yeah. Is it worth it?
I want to see. Appreciate you. I want to see if you can get hamstring on that right side without me
Yep.
giving the heel dig. And I'm going to kind of pick the camera up and we'll just kind of provide a different perspective of what Cody's doing. So, Cody, bend your right knee back a little bit more so it's at about 90. There you go. Yeah. Hi, people.
Great. Nice tank top.
Available at
Resilient Tank
Performance Physical Therapy.
not available.
Okay, so you'll see that Cody is slouched. He's got his rib in the butt bone.
Keep
And
requesting
he's
info.
reaching. He's keeping that rib cage dropped back, and we're just kind of isolating it towards a little bit of trunk rotation with that right reach. Good. Awesome job, Cody. There we go. How was that, Cody?
It's good.
Good. Any problems with that?
No.
Okay. So I'm gonna have you do one more round each side, just so we get the volume. Now, believe it or not, Cody, I've just developed amnesia. Completely forgot how to do this exercise. Talk me through all of the steps.
So, sitting on the edge of the chair,
Yes, sir.
rolling back, tucking my hips underneath me, sitting on my butt bones.
Mm-hmm.
Bias myself a little bit to the side. I'm trying to ground myself more on, get the hamstring. Digging my left heel into the ground, keeping
Yep.
left heel and left butt in the seat.
Yep.
Kicking the opposite leg out,
Mm-hmm.
reaching for the foot,
And when you kick, what should you feel?
left hamstring.
Okay.
I got my left heel, left butt.
Got it.
And here, and when maintaining all those, kicking my right leg out, reaching with my left hand.
Mm-hmm.
Inhale quietly so anybody around me couldn't hear. Exhale, making like trying to make fog the window,
Yeah, totally.
and pausing 3 seconds and repeating that.
Cool.
Okay.
Had to have been coached before the camera.
Exactly. And so as Cody's doing this, when I hear that explanation by the patient, I'm making a mental note of what words they use, because I will write, once I print out a copy of that activity, or I take a video, or I do something like that, I either will have them write it, or if I'm short on time, I will write it, but I will use the same language they used. That way they remember a little bit more better. Mo better. Good. Really nice, Cody. Good.
Everyone together now.
Is that all right?
Hi.
What's the name of that song?
What is that song? So, we're just going to wait for Cody to do one more set on the opposite side. That way we get a little bit of volume, because this is probably the volume I would give Cody to do this at home. So again, to reiterate why I chose this for Cody, he has a large amount of straight leg raise given the limitations he has in the frontal plane of his hips. Getting him hamstring, my hope, helps get him the mobility in the frontal and transverse plane, and also helps mitigate that excessive mobility there. Having the upper back free is going to allow him, in theory, to get a little bit more transverse plane motion in the upper back, because we're allowing him to flex. So We're really emphasizing sagittal on both of these areas. We're good?
Good.
Okay. Since you're already here, go ahead and stand up, and let's just recheck your standing test. And that's more, again, I want to make sure that I'm heading in the right direction for Cody's purposes. And so feet together, just so we're consistent. Go ahead and turn your head to the right. How we doing, big guy?
No pain.
Awesome.
Yeah.
I mean,
A
that's...
little apprehension at first, just because I woke up pretty sore this morning, but
Yeah. I mean, the motion is
Yeah.
day and night difference. That's pretty good. How about tilting your head to the right?
a tiny little bit, but
Okay.
like much better.
Awesome. And then flexion, I think, was the other one that bothered you. So let's just see what that looks like.
I feel it at the end way further than
Okay.
I did initially. I felt it about halfway down. Now I feel it right when my chin starts to graze my shirt.
Yep.
Yeah.
Awesome. Well, not awesome. I still want you comfortable. But.
So right there.
Okay. Let's go ahead and get you back on the table then. So, my thoughts right now, I'm fairly happy with that change, and I bet Cody's pretty happy. I mean, you tell me, Cody. I mean,
Yeah,
would
much
you be
happier.
okay?
This morning I was really uncomfortable.
Now, if you weren't Zach's friend, how would you feel?
Much more comfortable.
Now that said, I'm not happy with that because he's still got some limitations in side bending. He still hurts, and because Cody's my friend, I want him to feel really, really comfortable, especially because he won't see me for a decently long time, which is depressing for me. I want to see what shook out from a passive test standpoint, see if we can give him something else to see if we can clean up that side bending and flexion. So the IR and ER was okay. I'm not super duper concerned about that for right now. Let's go ahead and lie on your back and we'll check the shoulder stuff because that's probably where I'm going to go next.
Zach, just laying here too, for me, one of the most uncomfortable things this morning was waking up, and even when I first laid down too,
Yeah.
picking my head up was almost unbearable. This morning, getting up, I had to roll over to my side and carefully move my head, even when I first got on the table, and that's I'm very comfortable right now.
Great. That's really exciting. It's really exciting. So we'll check rotation first. We'll go into IR on the left side. So he's definitely we definitely have a little bit more. We'll say 60, but he's still limited. I want him to get to about 90. External, that's full. That's definitely 90. That's nice.
Yeah.
Which, again, I would expect ER to probably come back first if we're getting an improvement in thoracic flexion, because the further I drive into extension, typically you're going to see a limitation in internal rotation first. Why? Who knows? As we progress further into extension, it seems like external goes next. On the right side. Definitely a lot more IR. I'd say it's symmetrical to the other side, but still limited. We'll say 60. I don't know, you tell me, Cody. And we got about 90 on
Feels much freer.
on external. Scoot towards me, check horizontal. Okay, still limited there. That didn't change. We definitely got a little more on the left side, but he's still limited. I will say 25. Let's go ahead and check overs. I mean, it's close. Yeah, I'll say I can extend it, but I definitely can't adduct his hip. MC Hammer. Okay. And I can't extend his hip fully on that side. Last thing actually I want to check, I'm sorry, Cody, can you go ahead and put your head back here, line your back?
Yep.
I just want to see what your neck's doing. And so we'll check that circle axial rotation again. Does that feel okay?
Yeah.
Right. I mean, that's pretty good. I'd say he's got full motion there. He's still all limited going left. And so what I'm thinking now is we definitely got some better sagittal plane motion. Given that we restored some external, and we're getting him to extend his hip at least on the right, but he's still limited in the thorax predominantly. I still want to go after something that's a little bit more biasing that. Now, given that Cody's got a limitation in horizontal abduction and internal rotation, and the fact that my bro is a benching madman, he's got some massive pecs, I want to see if I can give him an activity that helps reduce the amount of tone and usage of these guys here, these pec muscles. And so, again, if we're thinking about this from a shifting muscles, certain muscles acting as respiratory muscles and other muscles acting as postural muscles, and like, for example, if I have limitations in mobility from a horizontal abduction standpoint, to me that at least from my thinking would indicate possibly that we have an overactive pec, and maybe this guy is doing two jobs at once, and maybe that's acting as a respiratory muscle and as a postural stabilizing muscle. If the pec is active and is helping me try to pull in air up here, well, that's going to pitch me a bit forward into extension, which is going to limit degrees of freedom in the frontal and transverse planes, right? And so if we can do an activity that puts these guys on stretch, making them inefficient and becoming breathing muscles, and allowing them to relax a little bit more, I think that's going to be desirable for you, Mr. Benz. So here's how we're going to do that. And I'm going to help you a little bit. We'll do a little bit hands-on, because you got to get some hands-on love.
Yeah.
So I'm going to put him in a position where I can get a bilateral pec stretch. Okay, are you feeling any stretching at all there?
A
A little bit?
Yeah.
We're going to make it a lot of it. Keep emphasizing the hamstrings so we can get that full extension. And I'll tell you what, Bill, I'm going to steal this from you. Achilles heel, or Achilles tendons on me. You're going to pull up a little bit. I want you to gently dig down. Gently dig down. Is it okay if I lift your shirt up, Cody? Okay. And I'm going to help him pull this rib cage down to enhance that pec stretch. So go ahead and dig down so you get these hammies kicked in. You got it? And actually, I'm going to bring your knees in a little bit this way. Do you feel inner thighs work when you do that? Pinch your knees together. Same breathing like we worked on, my man. I want a quiet inhale. I want you to fog up some glass. Go for it. Do you feel a greater stretch in your pecs this way? And I don't mean to lead you. Quiet inhale. Good. Fog up the glass. Keep fogging. Keep going. Keep going. Keep going. Keep going. Keep going. Keep going. Keep exhaling. Nothing left. Nothing left. Nice job. Don't breathe. Quiet, gentle. Fog up the glass. Keep going. Keep going. Keep going. Come on. Nice job. Pause. Go for it. Get it out. So I'm just pulling that rib cage, dropping it down so I give him an anchor to stretch those pecs. Let's go one more time. Get it out. Get it out. Get it out. Get it out. Come on, come on. Nice. Take a rest. How's that, my guy?
Good.
Cool.
Yeah, really good.
Take a rest, take a rest. I'm just going to check his IR on this side. I mean, just after 5, we already got a nice change. I'd say he's at about 80. So we're going to do just a little bit of volume, see what happens. But we're definitely heading in the right direction. You know what? Actually, could I borrow someone's leg? Just to intensify this, I'm gonna do a little bit of manual stretching on the pecs while he's doing this. So Jason is going to be my my chair.
Guys,
And so I'm literally just going to glide him up this way on the inhale so he gets a greater pec stretch, and I'll just alternate. So we're gonna go 2 more rounds, Cody. I'm gonna do one on this side and one on the left, and then we'll see what happens, all right? Quiet inhale.
Are we squeezing here, Zach?
Yeah, dig down. That's fine. Get it out. So I'm gonna guide his ribs, drop them down. And I'm gonna put my hand right here to see if I can get a good pec stretch on that right side. Good, quiet inhale. Is that pretty good? Good. Get it out. Get it out, get it out. Come on.
Everybody exhale.
Pause. P-A-U-S-E. Quiet, gentle inhale. Yep, get it out. P-A-U-S-E.
Find your
Quiet
Achilles.
inhale. We're going to do 2 more breaths. Get it out.
Where's your Achilles?
You know, use the 1, 2, 3, 4, 5, and quiet, gentle inhale.
I'm crazy.
Get it out. Take a rest. It's all right.
It's all right.
Let's try one more left side. Make that really nice and nasty. Got him?
Yep.
Quiet inhale. Okay, Jason.
From my favorite one.
Get it all out.
We'll squeeze here, we'll squeeze.
P-A-U-S-E. Good. Quiet inhale. Get it out. Keep going. Come on.
There you go.
Good job. Good job. Pause. Quiet inhale. Get it out.
Just. He should not have done the word like that.
Pause.
Don't look back.
P-A-U-S-E.
This wrong.
One more, muchacho.
To escape by going to the heart.
Get it out.
He essentially cracked the
Nice job. Good. Take a rest. See what we got. So we're going to see what shook out after that a little bit. Obviously, Cody could do that at home, not with us, but he would still, as long as he gets a pec stretch, we're in business. So, again, IR is still about 80, but I mean, that's a lot more than what we had. I mean, I'd say that that's full.
Yeah.
I'm pretty happy with that, or at least damn near close. Let's check horizontal abduction. On that side, yeah, I mean, I'm pretty happy with that amount. We got about, let's say 45, 50, somewhere in there. Check the other side. Just so I don't fake a test. I'm gonna go all the way down to about, yep, does that feel okay?
Yeah.
Okay. Stay on your back. I'm gonna check neck rotation. Again, right was already pretty good before. Still a little, I'm not super happy with the left, but it's definitely heading in the right direction. And the last one, go ahead and lie facing
Zach,
the
does that
camera.
C7 rotation surprise you?
That would be limited left?
Yes.
Not necessarily. Again,
Based on your upper measurements.
based on my upper measurements, does it surprise
Does it
me?
surprise you?
You know, ideally, considering that we got such a nice change on the thorax, I would hope that we would have gotten an improvement with that. So, if we have a, I guess with the limitation in cervical rotation, if that still remains after we've cleared up most of this stuff here, then it's like there's probably something else that might be influencing that rotation that's up higher.
So in your opinion right now, you feel like you've cleared up the upper thorax as much as you should?
I don't know. And the reason why I don't know is because, well, one, maybe just a bit more volume on that could help him.
Right.
Two, one thing that I haven't been checking consistently is the breathing portion of things, and that could be my other retest to make sure that, like, okay, is Cody adequately filling each chest wall unilaterally? Because sometimes you'll see people will have full motion, but they still can't do that. And so there's the control piece that We need to know if he gets that.
So right now you would say that you probably don't have enough information to like make that call, right?
100%.
Okay. I just want to be sure.
Yeah.
Okay.
Yeah.
Cool.
And moreover, it's like, again, he got, especially during the first time that I'm seeing Cody, I want to make sure that I can give him two things that be listed most of the change that I want.
Right.
And so that's kind of what we can do for home. That's it. I mean, you tell me, Cody.
Much for you.
Now he's still limited. I can't deduct him all the way. Let's go. Flip to the other side. Now I can definitely fully extend him there. But you still don't have a deduction. Now all this gives me information about where we're going to have to go over the next time that I would see Cody, but Cody doesn't give a shit about this. Let's go to the tests that are meaningful to him. Go ahead and stand back up. And so we'll just recheck that. I know rotation felt good last time. Let's go feet together just so we're consistent. Go ahead and turn your head to the right. You're still there.
Nothing.
He's starting to look like the chick from The Exorcist. That's good. Let's go chin to chest. Linda Blair. How's that?
Much better.
Are you feeling anything?
Slightest bit of tension, but it's not pain anymore. It's like
And where are you getting the tension at?
right
Okay. Okay. And then the last thing is the side bending to the right.
No, now it just feels like a normal stretch.
Now it just feels like a normal stretch. Okay, good, good. So I mean, from a home program, I'm definitely pretty happy with that.
As am I.
As
am I. Yeah.
Well, good. I'm happy to hear that, Cody. I'm just going to see if we can make that. So I'm going to do just a quick manual technique just to see if I can desensitize that area locally, so I can get Cody feeling super duper comfortable with the chin to chest movement. Because if he's feeling super duper comfortable by the time he leaves, I know Cody's going to be happy. I'm going to be a lot happier, and Cody's going to be more likely to do his stuff at home. Go ahead and line your back. So I'm just going to find some type of sensory input to give Cody right now, just to see if we can get a little bit more comfort. So I'm just going to kind of press around the area that he was sensitive. Any soreness there?
Not too bad.
Not too bad?
Little tender.
A little tender? Compared to the other side.
Right's more tender.
Right's definitely more tender.
Okay. What are you going after there, Zach? So right now,
I don't know.
you just kind of poking around.
Yeah, I'm just kind of poking around, getting a feel, and that's the thing. It's like we know that we cannot be specific with our manual interventions, and so I am just feeling like, where is he sensitive at?
You can't selectively tease out all the different neck muscles and figure out which one you're actually touching?
Heck no.
Oh, really?
Heck no, Douglas. I know, right?
Huh.
It felt
Hashtag EBP.
It felt like he was sifting through the fascia and was right on the levator. That's just my feedback.
Yeah. And so basically I'm just going to, because I know he's sensitive over what I would think is probably the upper trap region, at least in my mental framework as I'm doing this, I'm probably going to just do a technique that I would think in theory stretches the upper trap while I'm giving him some type of manual contact. And we'll see if that makes a difference, and given that when he brings chin to chest, that's going to elongate the upper trap and the attachments of the upper trap at the neck. Maybe if we alter the context as to which he feels that, we may get him a little bit more comfortable. So I'm going to do a little bit of pin and stretch over that area.
No.
It's not. Just to see if I can
There's going to be
reduce
a
that
lull in the
sensitivity.
volume for a few seconds there.
That's okay. I mean, editing this won't take super duper long.
It's going to
It's
pay
just
for his
expensive.
private jet a little bit more.
It's okay.
Yeah.
Good. I'm actually gonna recheck the neck test just out of curiosity's sake, see if we got changed.
It's James Dunning this.
You want me to manip him? I thought about it.
Once that makes everything all better.
It's a good input.
We'll take it a little bit.
That's actually a little bit better.
What?
Feels pretty good.
Yeah. So just do something quick and dirty, see if we get a change. Go ahead and stand up again. Let's check your chin to chest one more time. How are we doing, big guy? Nothing? Awesome. So We gave him 2 activities.
You have to come down to Arizona for some manual work.
Absolutely. Just manual work and then hanging. So we gave Cody 2. Let's summarize this. We gave Cody 2 activities. What did we emphasize? We emphasized getting him a little bit more frontal and transverse plane mobility by establishing some awareness and control in the sagittal plane via the hamstrings, and then a little bit of upper back expansion. That was step 1. Okay. We got a little bit of limitation still in rotation of the trunk with horizontal abduction and IR, and still a little bit of limitation in sagittal plane hip extension. So we wanted to keep the hamstrings engaged. And then because, as we know, given the horizontal abduction limitations, that the pecs potentially could have been overactive, we did an intervention to see if we could get those to stretch and relax a little bit more. That's step 2. The combination of those 2 activities got most of Cody's neck pain to go away. One, but also restored a lot of movement both in the hips and the trunk and the neck. So pretty happy about that. And then the last thing I did was just a little bit of manual technique just to get him a little bit more desensitized locally to help him feel better with that last little bit of chin to chest that was problematic. And so, what do you think, Cody? Any questions?
You're doing great. Thank you.
Awesome. You
Appreciate
bet,
it,
man.
my brother.
You bet. Any questions from the peanut gallery or comments, or like what would you guys, and maybe this is a good topic of discussion, like what would you guys have done differently given what you
What
saw?
if he was female? Would you have changed your manual technique?
So if he was female, that's a good question. So
You're
question
working
from
alone.
Bill.
You're working alone, and you have female. What would you have done?
Crack the door open, 1. If I was working with a female and she had limitations in pec mobility, we'll say just like Cody did, I probably wouldn't have put my hand up here. And I would have just at 1 asked for consent and said, hey, is it okay if I put my hand on your rib cage? And if I got a yes, then great. I would have just put my hands on the lower ribs, making sure I'm away from the breast tissue, and just glided down that way. If she said no, good. I would have coached the hell out of the breathing piece a lot more and made sure that, okay, I'm going to just ask, can I put my hand underneath your lower back, or put something underneath the lower back, drop the ribs down into into that object. And so you can still accomplish a lot of the same things even if you don't put your hands on someone. But Cody loves when I put my hands
It's the best.
on him.
It's the best.
Other questions, or like what would you guys have done
Why don't
differently?
you have him take your shirt off? Just like,
The internet. I didn't want to break the internet. Cody taking that shirt off.
well, the answer is actually he can't take his shirt off unless you shave it off.
Preparing for winter.
Already prepared.
Well, maybe looking at, and this is that's actually a good topic, and I know, Bill, I'd actually like to hear you say something on this, on the static postural assessment, because maybe, I don't know, it's been a while since I've seen you treat. No? You want to come up?
What about?
Well, I would say, like, maybe I'm doing just a blink on postural assessment at this point, but I don't think seeing Cody shirtless and maybe looking at the size of his pecs, which I could see through his shirt, if that would have added anything from a treatment lens. And that's the thing with, like, I think it's like just static and watching people move and all these things is just to clarify the picture or reinforce some other things that we may have seen on the table.
It's you don't want to overvalue one small element.
Mm-hmm.
Everything contributes.
Yeah.
You know, it's when people over exaggerate the value of posture or undervalue it as meaningless. It's
Yeah.
like it's always going to be somewhere in between. It's like you put the whole picture together. You get extremity movement. You know, it helps you determine your intent, right? So the picture that you formulate based on your understanding is driven by any number of things. And so, okay, how much value do you need, from one element versus another? And so that's where that's going to fall. It's like one small piece of a puzzle that is incredibly complex, right? So
That's great.
I don't think you need to do, some sort of incredibly detailed postural assessment, but look,
Yeah.
Right? I mean, it can provide you an element of information.
Yeah.
But don't, place it on a hierarchy above something else until it's meaningful. And it's like, when does posture matter? It matters when it matters.
Yeah.
I mean, that's hard for people to accept.
Yeah.
Because it's vague and it represents a concept of not knowing, which
Yeah.
again makes people uncomfortable. We'll get used to being uncomfortable.
Yeah. And that's the thing. It's like, I'm doing this. I was going to do this live initially, and we were talking about this, but then the internet in the Hamptons is not ideal for that. It's not. I mean, it's just
Thanks,
people use
Greg.
the internet, and it's like, I
Thanks for the house and the pool.
yeah.
Like the
I mean,
internet.
it's, yeah.
Fix your Wi-Fi.
Yeah. We were going to do this live initially. We tried a couple times and it didn't work. And it's like, well, what if I had failed on live? And it's like, good. That just means that the intervention I tried weren't the things that this gentleman needed to get better. And so, like, even when you fail and you don't hurt the person, it's still gathering information. And it's like, okay, clearly doing some type of intervention that targets what I think it's going to target. I thought would have helped. At least I know, okay, I don't need to address that because that's not what it's going to take to help Cody feel better. And so, don't be afraid to fail one, and then just don't put too much stake in any one test. Whether it's doing your blink moment with your posture, with your gait, or watching someone move, or even looking at stuff at the table, because you kind of have to put a clinical picture together, try something, and then see what shakes out afterwards, and that'll let you know where you need to go next, or at least, do I need to go down a different path? Anything else from anyone?
I got a question for you.
Yeah. So this is Jason.
Sorry,
You're okay.
I guess I'm wondering, on those couple exercises that we did have him do, are you at all concerned with him doing too much work, trying to contract things too hard? Does that ever come into your mind?
Totally. Well, with Cody, Cody did a good job of not doing that because Cody knows kind of what to expect and what to do. But there are some individuals who that is the case, and it's like if you are going so high tension and high threshold, chances are you're likely not going to see a positive change on the test. And then it's like, okay, then I need to reformulate the coaching strategy in such a manner that he doesn't go so high threshold, high tension. Now that said, like if I had never seen Cody before, and maybe like the only way I could get him to exhale, because like that was kind of my primary goal with a lot of these things, because the exhale is going to allow me to restore some sagittal control. If we got a positive change in the test, but maybe it was a little bit more high threshold, high contracting, then maybe I'm okay with that as a starting point, as long as we're getting something that's meaningful from him. And I see Bill vehemently disagreeing. No. You wouldn't have been cool with a high threshold?
That term just kind of bugged me.
Oh, high threshold.
Yeah. It's a threshold.
Yes.
You're above or below it, right?
Gotcha.
Supra threshold.
Supra threshold. Oh, I like that.
Ultra threshold?
Ultra threshold.
Infra threshold?
Ultra
Yeah.
threshold has much more pseudoscience behind it.
But point being is like,
Probably sell better.
I have one of two options. I can either just let him go through with that and see if we elicit a change, and if we do, great. If we don't, then maybe I need to find a different position or a different movement context in which maybe he can operate under a lower threshold. And maybe I just needed to cue him a little bit differently and say, maybe the glass fogging wasn't the answer, and it's like maybe I needed to go because he did really well with the soft inhale, but maybe he would have needed a soft exhale.
But his work rate only matters whether or not there's you get the desired effect.
Yes.
That's
And most importantly, and this is something that...
Wait. So what you're saying is there's different ways to do things and still be successful?
No. That can't be right.
This
Well,
is the point where I
There's
leave.
only one way. Everybody knows that.
Yes. Well, that's correct. I mean, this is Zach Couples' way. ZachCouples.com. Please download my newsletter.
And smash that like button.
That's right. Like this. Share this.
Brazilian tank top.
Now,
St. David's High School football. Woo!
But Bill provides a good point though.
Reference of the week.
Oh, God.
That was awesome.
What did I say?
Um,
Things are different, but the same.
Yes. No, I mean it's a good point though, Bill. And it's like, and I think we've all been in this part where we get attached to doing something a certain way, and we scoff at individuals who don't do it our way. And it's like, even if I changed everything on with the testing algorithms that I incorporate personally, but I didn't do something that was meaningful for Cody, like let's say his neck still hurt, then who cares? And it's like, it always has to come back to what's meaningful for this guy right here. And if, regardless of what treatment modalities you use or what approaches you use, make sure you're doing something that is going to help this person and do so in a meaningful way. And so there's a lot of times where in the past I would have gone through and maybe done some stuff, and if I had gotten some positive changes on my testing, I would have been happy at that and left it there, but even if they still hurt. And it's like, that is a huge mistake that I have made in the past. And it's like you still have to always put in something meaningful for the patient at the forefront, because if you don't make a change, even if you think with a few days of doing intervention X that's going to be helpful for them, if it's not meaningful to them, then they're not going to do it. And so that's kind of been the biggest piece. And so do whatever works for you and your patients, most importantly for your patients, and then fill in the gaps from there. Anything else, party people? Or what would you guys do? I mean, I would have been curious, what would you guys have done differently than me? I mean, I kind of like the trial by fire here. Is there anything else you guys would have gone after?
Well, I think your outcome is the evidence.
Yeah.
Don't you think?
Yeah.
I mean, you got everything you wanted, right? Mm-hmm. Cody feels better.
Yeah, personally, I don't care if you were to get anything else. I feel fine now.
Right. Right.
So,
Right.
From a patient standpoint, right? Like, now granted, like, I value some things that maybe a stereotypical patient you may see day to day that does not really care about. But I mean, at the end of the day, like, you can sit over here, I can turn my neck and have a conversation with you and not be in pain. So that's what matters
Gaze
to me.
longingly into his eyes.
Into those baby blues
And lovingly.
Yes.
and lovingly.
Yeah, I think your evidence is the outcome, right?
Yeah. Yeah. So, yeah, he's comfortable. All right. Cody, pleasure as always, man.
Thank you, my brother.
Yeah.
Predator pose.
Yeah, I got you pushing clinic.
So I think we're going to call that it for today. Please subscribe to me on whatever social media device you want. I'm on Facebook //ZCouples. I'm on Twitter, handle is ZCouples. I'm on Instagram. Check out my hiking pictures. Zach, ZAC Couples. You can also check me out on my website, which you might be doing this on there, ZachCouples.com. Subscribe to the newsletter. I do weekend learning goodies every Friday where I give you guys a bunch of different things that I've read or come across over the week. It's pretty interesting, and it ranges from something more learning oriented to whatever type of music I'm listening to. You can also download a free acute to chronic workload calculator, which has been at some point I'm going to do something big written on this, but it's been huge from a just patient outcome standpoint, incorporating like return to running amongst other things. Other than that, you guys stay classy, keep it real, but not to the extent where things go wrong. Stay hungry, keep learning, keep focused, keep getting strong, and I'll catch you next time.
Always hungry.
Peace out.
Deuces. Yes.